Okay, so we'll be discussing about the Diphyllobothrium latum. Again, your Diphyllobothrium latum is the only one species here in your Cestodes belonging to your Pseudophilidia. Other name for your Diphyllobothrium latum, this is your fish tapeworm, also called here your broad tapeworm. Again, it's being called here fish tapeworm because this intermediate host here, the second intermediate host is the fish. And this is the only species here in your Cestodes which have an aquatic life cycle. So we speak about aquatic life cycle. So ito lang ang nasa tubig ang kanyang life cycle compared with other species here which are non-aquatic. Okay, so it's being called here as your broad tapeworm because the graviproglottids, if I try to check the segment, okay, it's more of broader than long. So medyo makapal siya compared sa kanyang haba. Okay, the first intermediate host of this one, so this one requires two intermediate hosts. Okay, so the first intermediate host here would be your cyclops or your copepods, and the second intermediate host would be the fishes. For the morphology, the adult worm, this one will have your ivory or grayish white, grayish yellow in color, and it's considered to be the longest of all our tapeworm, having 3,000 proglottids. In the Scolex, this is different from all the other species of your Cestodes because again, this is a Pseudophilidia. So what it has here would be small almond-shaped grooves instead of the suckers. Wala siyang suckers but rather what you call that one as the grooves or bothria rather than the suckers. Okay, for the proglottids, the mature proglottids, again, let's try to house here your both the male and female reproductive organ. And then we have here it's symmetrically having bilobe ovary. And we have here dark rosette-like uterus, which is highly coiled, found at the middle part of the proglottids. The graviproglottids, on the other hand, is broader than long, is creamy white. Okay, the ova, so being one belong here to Pseudophilidia, will have here the different characteristics as with respect to other species of your cestodes. So this one is operculated ova. So this one is grayish white with small inconspicuous operculum. So I mean to say small lang na operculum, but then again still operculated in one end. The other end of that would have your small knob-like thickening on the other end. Inside the ova, this contains here mass of the cells without the embryo because again this one is immature compared with other cells which are already mature. Mean to say, pag immature siya, it still requires embryonation before it try to hatch and liberate here the next stage. Okay, now we have here the life cycle of your Diphyllobothrium latum. So we have here the egg coming from infected the patient's definitive host. Try to shed that one. Again, the egg do not have here the embryo yet, and therefore it try to require it to be embryonated once it go to the water. So embryonation in the water takes place. As it try to embryonate, it try to form embryo and then try to hatch and try to liberate here your first larval stage. You call it was your coracidium. Then the coracidium will be taken up by the first intermediate host, which are your copepods or cyclops. Inside the body of your first intermediate host, your coracidium will develop here to become your procercoid. Then the second intermediate host, we're going to eat the first intermediate host. And then the first intermediate host, since that one contains the procercoid, once eaten here by the second intermediate host, the procercoid we're going to develop here to become the plerocercoid. And the plerocercoid will become the infective stage to your definitive host. If you try to ingest the second intermediate host having that uh, um, plerocercoid, like if you try to ingest say, the second intermediate host being raw or uncooked, then you get infected by that. So once it's in your body, your plerocercoid larva will develop here to become adult worm, and then adult worm try to attach to your small intestine and try to perform here self-fertilization. Then the graviproglotids here will eventually try to shed the egg. Again, this since one belongs to your pseudophilidia, it tried to shed the egg not by rupturing the uterus or by apolysis, but rather by passing through. Lalabas siya talaga sa butas ng kanyang uterine pore because again, it contains here the uterine pore. Then the eggs are shed on that. It will pass going to the body of water, and again, it try to undergo embryonation, and then the cycle continues. Okay, then we have here the so-called sparganome, or called it once your plerocercoid larva. So this is characterized as elongated, spindle-shaped, chalky-like, pseudo-segmented worms. And this one would have the absence of the scolex. Wala pa siya head part. And then at the same time, that one, since larval stage pa lang naman ito. Then we have here the anterior side would have here the worm-like body. And the posterior end would have here a spherical appendage containing here 6 hooklets. So, human could also serve here as second intermediate host kung pag kinain mo ang first intermediate host. You call that one as your sparganosis. So, you get, mean to say, the human could serve here as second intermediate host where the procercoid will develop here to become plerocercoid sa human. If again, you try to ingest here the first intermediate host, the copepods or cyclops containing here the procercoid larva. Or you try to ingest here the raw infected fish or amphibians. We have also here consumption of your raw pork. Or you could also here ingest other species of the parasite containing the plerocercoid larva like in the Spirometra species or your Sparganum proliferatum. Okay, then we have here the disease pathology related to your dilatum infection. So the larval stage, try to cause here local tissue inflammations which is edematous. So medyo naging namamanas, accumulation of the fluid in the tissues where you could find the larva. And at the same time, it's painful to touch. The death of the worm here would result to your local inflammatory reactions, resulting here to your charcot-laden crystal formation with your eosinophilia, and we have also here your charcot-laden crystals. Then the ocular sparganosis, so the larva could eventually go here to the eyes, and it result here to eye irritation, eye inflammation, and we have also excessive lacrimation or crying tears. Adult one could try to cause systemic adult manifestation since remember that adult worms try to inhabit your small intestine. It try to cause systemic toxemia because of absorption of the worm here with the different toxins. Second one, it might also result here to the obstruction in your gastrointestinal tract and your intestinal tract because of the large size of the adult worm. So, bumabara siya doon. The third one, we have here your anemia. Anemia here in the form of your vitamin B12 deficiency anemia. And that's considered here to be your megaloblastic anemia. And that's your hyperchronic, macrocytic hyperchromic anemia. Why vitamin B12? Because again, this, your dilatum here try to eat or ingest here the vitamin B12 that would eventually deprive the host here with the vitamin B12 and that result here to vitamin B12 deficiency anemia. For laboratory diagnosis, you could perform the DFS for identification of the ova in the stool of the patient. You could also perform concentration technique. You could also have your surgical removal of the larva and could also have tissue biopsy also for identification of the damage caused here by the larva. Okay, now next one, we have here your Echinococcus granulosus. So this is your hydatid cyst worm. Okay, this is your hydatid worm. It's also called here your unilocular hydatid worm. The first intermediate hosts of this one are rodents like rats, for example, whereas your second intermediate host would be the cats or even the dogs. Okay, for the adult, this one considered to be the smallest, having the globular or piriform na scolex for capsuckers and arm rostilium, ang mouth part niya contains here a double crown of 38 to 40 small and large hooks. Sa strobila, so tatlo lang strobila niya, making this one the smallest. One, short, immature. We have here one segmented na mature part. And we have here the one long gravid na proglottids containing 12 to 15 lateral branches. The ova, resemble here your tinea. So that one is your spherical striated eggshell with hexagon embryo. So ano na siya, mature embryonated, having 6 hooklets. Okay, then we have here the larval stage. The larval stage of this one, you call that one as your hydatid cyst. Hydatid cyst here, so this one developed here from the egg. So, nagiging larva na siya, you call that one your hydatid cyst. The hydatid cyst here, so para siyang cyst bilog. So, that one here, primarily is being formed here on the tissues of the infected patient. So, this is the fibrous capsule here. So, ito galing sa tissue ng host natin. Itong parasite mo, gagawa siya ng sarili niyang fibrous capsule. Then, ang cyst nito, this is your hydatid cyst, divided here into two main layer. The outer layer, we describe this one as lamated, milky opaque, and that one is non-nucleated, walang nucleus. The inner part, on the other hand, is nucleated, may nucleus. Then, nasa gitna niya, you call it one of your hydatid sand. Ano makikita dito sa hydatid sand natin? May fluid dito, you call this one your hydatid fluid. Then, meron ditong mga bilog-bilog din na become your free brood capsules. And may mga scoleces. Pag sinabi scoleces, scolex, ito yung head part or mga developing na worm dito sa loob. And the entire content of that, you call that one as your hydatid sand. Okay, then we have here the description of your hydatid sand. So hydatid sand, you could aspirate that one and then eventually that's result here to the, pag na-aspirate mo ang ating hydatid cysts, you're able to recover here the hydatid sand. Again, yung hydatid sand contain here your protoscoleces myscolex which are invaginated within their body. Nakatago ang kanyang suckers. But if you could try to add that one with your NSS, they try to evaginate, lumalabas sila and we're able to see them. Plus, you could also find here free brood capsules on that. But then again, when you are having the aspiration, be careful not to rupture your free brood capsules because that one is highly antigenic. So, pag nag-rupture mo siya, try to cause your anaphylactic reaction. Anaphylactic reaction is a severe form of your allergic reaction. It matters so here to your shock or death of the patient. Then we have here the types of your hydatid cysts. Unilocular, so that's in the case of your Echinococcus granulosus. That could be infecting here the liver, your lungs, and brains, where you could find here your hydatid cysts. Osseous, on the other hand, you could find it on your bones. So this includes your Echinococcus multilocularis. And we have alveolar, so that's in your lungs, alveolar lungs. So that's your Echinococcus multilocularis, and we have your Echinococcus vogeli. For the life cycle, so again, the eggs here being passed from your definitive host will be taken up by your first intermediate host, which are your rodents. Inside the body of the rodents, the eggs here try to hatch, liberating your larva, and that develop that one to become here the hydatid cyst as its larval stage. Then, if the second intermediate host are going to eat your first intermediate host containing the hydatid cyst here, which is the larva stage. So your definitive hosts, which are your cats and dogs, will eventually get infected. Then the larva stage inside the body of your definitive host will develop here to become adult worm or try to attach to the intestinal mucosa of your dog and cats. And then eventually the adult worm become gravid, lay egg, ruptures the uterus of that, shed the egg on the pieces of that, and again the cycle continues for that. Okay, now we have here the clinical manifestation of Echinococcus granulosus. So most likely your hydatid cyst might lodge here and most likely in the liver and making that one highly affected organ. Okay, the hydatid cyst might be ruptured because of the surgery, because of your biopsy, because of coughing, because muscle strain, or even aspiration technique. That's why when you are aspirating that one, be careful not to rupture your brood capsule because again, that one is highly antigenic and deadly pag nag-rupture. To diagnose here, you could have your x-ray for identification of your hydatid cyst. Makikita yung mga cysts, mga bukol-bukol o mabilog-bilog. You could also perform here the skin test, your intradermal skin test or Cassoni test. You could also have your immunoserological testing like your precipitation test for antibody, antigen-antibody reactions. You could also have fluorescent antibody test for that. The counterpart, we have your Echinococcus multilocularis. This is your osseous and alveolar Echinococcus. Okay, the straw below of this one would have your 4 segments. Medyo mahaba siya compared with your Echinococcus granulosus. Again, Echinococcus granulosus would only have 3 segments. Ito we have your 4. 1 immature, 2 mature, and 1 gravid proglottis. Okay, the last one, we have here the multiceps, also called here your guidworm or cinerosus. Again, try to cause here your cerebral and ocular cineros. And to see the larval worm here could eventually try to lodge in your brain, so yun ang mahirap pag sa brain, and also your eyes. Okay, so it tried to cause here the disease to cause your blind staggers, which are manifested in the domestic animals. So, blind stagger here is just staggering or giddiness. Kaya tinawag siyang gidworm. When we speak about giddiness here is the dizziness, vertigo, so nahihilo ang patient at nangingisay, leading to your staggering. So, that's your blind staggers. Intermediate hosts for that are your sheep and man, and definitive hosts would be your canines. Now we go to the morphology. Adult worm would have here the scolex, character spiriform with 4 cup suckers armed with small and large hooks. The graviproglotis, on the other hand, contains 18 to 26 lateral branches. The egg would resemble your tania, so that will have your striated eggshell with the hexagon embryo with 6 hooklets. The larva, this is the larva, you call this one Cinorus, is globular, sausage shape, wherein characteristic, this are yung mga scolex, maliliit, mga worm ito, which try to be arising here on the marginal side of the entire Cinerosus or the bladder worm.